There's a lot of relief on that. Let's go live now to Charlotte Maxeke, Nqobile Madlala, eNCA reporter, joining us. Nqobile, finally, good news for many patients who had to find alternative means to get treated for all sorts of diseases over the last 2 months. Charlotte Maxeke set to open on Monday, but there's been a lot of pressure, of course, in the last few weeks. I mean, just the other day, I spoke to the Wits University's Donald Gordon Medical Center. They were now even threatening or considering legal action against the provincial government and the hospital, but at least that won't happen. It will reopen on Monday.
Yes, there is definitely good news, Dan, in terms of opening. And talking about that pressure, Dan, there is a lot of pressure that was there. In fact, some of the doctors were going out on a protest, on a picket, which were lunchtime pickets, where they were asking for the hospital to come back into the pool, saying that the hospital has over 1,000 beds. And this is very important at a time when we are fighting COVID and there are other illnesses that are now not getting the right treatment. Of course, speaking to some of the people that we're talking about, the fact that the cancer patients being one of the main affected people in this case. But we have done a walkabout, Dan, and DID here is joining me now to explain how the hospital has been and if it is, of course, structurally sound.
Thank you very much. Let me first thank the Human Rights Commission colleagues who visited us today. We have done the inspection with them to look at, one, the work and the progress that we have done so far. They have confirmed, one, that our report that the radiation oncology is fully compliant now, no longer interim or partial compliance. The building will be fully compliant in terms of Fire Act, secondly in terms of Environmental Act, and thirdly in terms of structural compliance. We have received a certification from our structural engineer, who is independent engineer, who we had to appoint to assist in terms of assessment and also make specific recommendations. And that those recommendations have been fully implemented and they have been completed already. And today we are simply waiting for the City of Johannesburg to send their fire engineers and compliance officers so that they can issue what we call a certificate of occupancy. And upon that, we then, as DID, issue a handing over certificate to the hospital management to say that the building is ready for use. There is a plan already that has been put in place by the hospital team that they want to receive their first patient on Monday. So we are ready. We are so excited. In fact, I must say that we as DID had to move mountains to ensure that by today the building is safe. You recall that the first plan was to complete the radiation far beyond the 25th of June, but we had to go all out to negotiate with suppliers who are only few in the country in terms of certified suppliers.
And what took so long?
It didn't take long. We have finished earlier than anticipated, as I'm saying, because these fire doors, for example, which have been the only outstanding issue. When we brought the city compliance officers to check and give us the approval, they said they were not prepared to give us the approval unless we bring new fire doors which are compliant in terms of new building regulations. And those doors cannot be bought from the shelf. We have to ensure that we identify around the country all certified suppliers in that area, and we could find the one in George in Western Cape who was able to deliver those fire doors within 2 weeks, and we have completed before the 2nd of July, which we are very happy for.
All right. And of course, understanding that you guys are now opening the building, but there are some parts that are not going to be open and that you have not even worked on yet. Please elaborate. Yes,
the whole hospital precinct, there are only 2 areas or 2 blocks that are not ready for use. One is the Block 4 North and Block 3 North, because the fire happened in that area. But otherwise, the entire hospital precinct has been rendered safe for use. What basically going to happen now, the hospital team has put in place already. That plan would indicate how some areas will have to be repurposed to allow other services beyond oncology services to be to be provided. So you'll be getting dates from the hospital in terms of which services will open up. Of course, it will be done in phases because we've got to allow the patient management, so to speak, to be managed. But the unsafe area, which is Block 3 North and Block 4 North, we have got a plan in place. The probing contractor is already in place. He'll finish the work by 26 July, upon which, once completed, the police will then do the forensic services to test, one, what was the cause of fire, secondly, whether there was any human interference, if there was. And then once the police have done that, we'll come back and do structural assessment and do some provision. Part of the options that will be done is either if the beams that protect the entire Block 3 and Block 4 are firm enough, there will be no need, but we will have to support them. If the recommendation come and say that the beams have lost the strength in terms of structural sound, those specific areas which are barricaded cannot be used and they are not being used now, we'll have to demolish and rebuild them so that they are strong enough to take care of the areas that are rendered unsafe. But I must assure the public that the hospital, in terms of except those 3 blocks, the hospital has been declared very structurally safe by our structural engineers.
All right, thank you very much. It does sound like a lot of work still needs to be done, Braddan, but for now, oncology will, of course, be the first one to come in.
Thank you very much, Nqobile Madlala, there at the Charlotte Maxeke Hospital. Good news indeed. It's one of those important hospitals here in Johannesburg. Back to operation seemingly from Monday.